Welcome to the Eye Care Explained channel. This channel is for those interested in eye-related issues from various perspectives. We'll discuss eye disease diagnosis and treatment, explaining ophthalmological problems and eye care in simple terms. My years of experience in a large university clinic have shown that such a seemingly simple procedure as instilling eye drops, if done incorrectly, can be ineffective and in some cases can create problems. This is especially important in situations where a person needs to use eye drops constantly. I'm Alex Ermolaev, PhD in ophthalmology and PhD in pathophysiology. Today, let's talk about how to properly instill drops for glaucoma. Glaucoma is a disease that ranks second in the world among the causes of irreversible blindness. We'll discuss the essence of this disease and the reasons why glaucoma makes so many people blind in a separate episode. Today, we'll talk about how to properly carry out the process of instilling hypotensive drops for glaucoma. If you find this video important for your friends and relatives, please share it with them. Before we discuss the technique of proper eye drop installation, let me give you some theory. You should instill drops with clean hands. Don't touch your hands or other objects with the tip of the bottle or dropper to avoid introducing infection. You can instill drops in any comfortable position, lying down, standing, or sitting. This depends on your physical condition. It's only important that your position is stable. You should instill only one drop into the eye because the conjunctival sac, the space between the lower eyelid and the eye surface where we instill drops, can't hold more than one drop of the medication. A second drop is only needed if you're not sure the first drop went where it should. Don't touch the eye with the tip of the dropper or bottle. This is important for the following reasons. Firstly, you may introduce infection into the eye this way, and if you're instilling drops in both eyes, you may transfer infection from one eye to the other on the dropper. Secondly, when touching the corneal surface with the dropper, there's a high probability of damaging its protective epithelial layer. If this happens, it can be a source of serious problems. When instilling, don't squeeze your eyes shut. Try to close your eyes as if for sleep. Then, with your finger, gently pull the lower eyelid down. Also, don't look at the dropper. It may involuntarily scare you and prevent you from relaxing. At the moment of installation, tilt your head back and look up as much as possible. This will make installation easier and reduce the risk of touching and traumatizing the corneal surface with the dropper. Now, a point especially important for those who must instill drops daily to lower eye pressure. The fact is that part of the medication that isn't absorbed into the eye's mucous membrane flows with tears through the tear ducts, located in the inner corner of the eye, into the tear canal. The tear canal goes almost vertically downward and opens into the nasal cavity. You may have noticed that if a person cries a lot, they start to snuffle and develop a runny nose. But this isn't a real runny nose, it's the tears that didn't have time to be absorbed into the nasal mucosa. Then, the medication that didn't have time to be absorbed into the eye is absorbed with tears into the nasal mucosa, and from there enters the body's general bloodstream. It's important that as little as possible of the medication a person instills to lower eye pressure gets inside the nose. The fact is that some of these drops, for example, drops containing V blockers, when absorbed into the blood, can adversely affect the heart and lungs. I was once asked, so does this mean that an ophthalmologist can prescribe drops that are knowingly harmful to the body? The fact is that this is an incorrect question. All medicines have, to some extent, pronounced side effects. There's no getting away from this. Medication should only be replaced when there's a real need for it. And to minimize the side effects of drops, you need to instill them correctly. Now let's move on to the practical part, the actual process of instillation. To prevent drops from entering the nose and from there into the general bloodstream, it's necessary to compress the tear canal when instilling. But how to do this correctly? You need to tilt your head back and carefully, with one finger, pull back the eyelid, and with another, compress the tear canal. When instilling into the left eye, if you're right-handed, it's convenient to hold the drop bottle in your right hand, while using the index finger of your left hand to pull down the lower eyelid, and the middle finger of your left hand to press on the tear canal. For the right eye, you need to switch the fingers of your left hand. Use the index finger to compress the tear canal, and the middle finger to pull down the lower eyelid. For left-handed people, everything should be done in mirror image. The point you need to press on is located midway between the inner corner of the eye and the edge of the nose wing. There's something like a bone depression there. If you do this correctly, you'll feel that it's comfortable for your finger to rest there. Press quite firmly with the pad of your finger. Don't be afraid. There's nothing in this area that you could damage. But don't make the mistake of pressing your finger into the very inner corner of the eye, as you might find in some recommendations. The effect will be less, and the likelihood of infection getting into the eye with your finger increases. Now, with your right hand, carefully squeeze out one, I repeat, only one drop of medication from the bottle or dropper. One drop of medication is quite enough. A second is only needed if you're not sure the first drop went where it should. After you feel the drop of medication has entered the eye, continue to compress the tear canal for about half a minute. During this time, the medication will be absorbed through the eye's mucous membrane, and the excess part of the medication will flow out through the edge of the eyelid. To prevent the liquid from flowing down your face, it's better to use a gauze or paper napkin. But don't rub the eye hard with the napkin, just dab it to remove excess medication. If you think this information was useful, please like the video. If this information might be important for your friends and family, please forward it to them. And don't forget to subscribe to the Eye Care channel so you don't miss anything important.
До свидания.